Thank you, Barbara. You can have a seat up front. I'd like to call up Marco, Janet, Maha, and Barbara to have a seat at the front. Turn on your microphones, and the audience should be reminded that Jenny will be participating in the discussion via Zoom. We'll be taking questions from those in the room at the microphone in the center. And Dr. Dranowski, please identify yourself first.
I'm Adam Dranowski, University of Washington. I have a question for Barbara and one for Marco. So Barbara, that was a great summary of the dietary guidelines process and ideas for integrating sustainability. But I want to remind everyone that there are 4 dimensions of sustainability, of which environmental impact is just one. There is also economics, food prices. There is also societal value, and yes, there is environmental impact. And for one, I have always been rather disappointed that the dietary guidelines never mentioned affordability as a component of sustainability. Now, to give the Dietary Guidelines Advisory Committee credit, mentions of affordability, financial burden, health equities always did show up in the Dietary Guidelines Advisory Committee. And then mysteriously they were cleaned out. So the final document made no reference to it. And then when it comes to societal value and food acceptance, those things were also kind of eliminated. For example, when you look at the current USDA healthy food patterns, the Mediterranean one or the vegetarian one, the Mediterranean one is more expensive, what you expect with 3 servings of fish per week. And the vegetarian one increases soy consumption by 600% over current values. So my suggestion to include sustainability concepts into future dietary guidelines would be to go with affordability and societal value in addition to the environment. What do you think? It will be an effective strategy to include issues of economics and society?
Actually, when I laid out those 3 questions, it was mainly to provoke discussion. Because at this point, I think each of us might bring something to the table that if we were to integrate into the dietary guidelines, what is the objective? And we might all have different ways of thinking about that objective. But I think that's the value of thinking about the topics, what topics are most relevant. And it could be difficult to do it, say, with this cycle, but if the topics start to emerge and we have agreement on how sustainability relates to the purpose of the dietary guideline, then we have a way to start thinking about how do you build that into the dietary guidelines going forward.
I would say affordability and cost is very close to what people are concerned about, so I would argue for that. Yeah. Okay, quickly for Marco, I have a question for Marco. We are looking at distribution of plant protein consumption in Seattle. Of course, it correlates completely with socioeconomic status, and we're doing a map. So people who consume protein, plant proteins, are the ones who consume salad and live in nice houses on the waterfront. So when you look at grossly aggregated data by country, you really are losing track of the very small geographic distinctions. How useful is it to look at country-level data?
It's a scenario analysis, right? So we don't do we obviously use projections, how people, what people consume, or what they are thought to eat. But of course, those are very general things, right? And those are really meant to illustrate some of the things and tease out some of the country differences, but they're not meant to inform like the very local things, right? I mean, there are discussions to be had on any level, I suppose.
Hi, Peter Lurie, Center for Science in the Public Interest. And actually, Adam mostly asked my question, but Barbara, I'm going to ask it in a slightly different way, and if you don't mind, put you on the spot a little bit. It's really a feasibility aspect of the question that Adam posed. He posed the question of sort of what should we do, and I want to ask you the question of what can we do. Given the current administration, do you actually see a reasonable likelihood of being able to integrate sustainability into the DGA? And if that percentage is greater than, let us say, 5%, which of those elements that Adam laid out do you think are most likely to fall upon receptive ears?
I'm probably not the best person to answer that question. I would make a couple of observations, though. One of the charges to this next cycle of the dietary guidelines is to address the B through 24. And that was very clear on the importance of doing that. And I think if you look at the topics that were proposed by the departments, they really were to try and address that life cycle piece. So I don't think we've seen the response back from the departments about the topics that will be considered. But I do know that B24 is a priority. And actually, what has been done around the B24 is a good case study for what it takes to really bring a topic forward in a way that the dietary guideline process can now grab onto it. Because there have been work groups, there have been people defining and refining those systematic review questions, really working on the topics ahead of time to say, how do we position it for the dietary guidelines? The other comment or observation I would make is our committee felt very strongly that we have to get away from this reviewing every topic every time, that there are some areas in the dietary guidelines that haven't changed for 20, 30 years. And so maybe we could sort of realize that it's not that they never be reviewed, but maybe there's a longer cycle between when they're reviewed, which then opens up the opportunity to say, are there other topics that are relevant in the way we think about the dietary guidelines?
If I may, I think this is also one area where the consumer can be an ally, because again, we're talking about sustainability and the 4 dimensions of sustainability, and these are really at the heart of what the consumer is facing: affordability, social and cultural dimensions, sustainability, etc. What about doing truly an ethnography or truly doing some very deep consumer research that would be an argument for the committee of the dietary guidelines to say, okay, well, when we ask the American consumer, these are the areas that they are interested in when it comes to their dietary guidelines, and now when we bring the dietary guidelines to them. Mm-hmm. So maybe the consumer could be helpful, because I'm pretty sure that they would be interested in all the aspects. Mm-hmm.
My name is Li Yang. Thanks for your presentation, and thanks for the organization for this conference. I'm thinking that your effort is all good, but the problem is from the stage of planning to the goal that you want to achieve. Maybe it's a long way to go, and maybe you have to be very careful to use a good faith and select the good faith people, because on this system, the problem is that every step of the way will be manipulated toward the wrong direction. From the planning to consulting selection to the goal of achievement your budget, the kind of who is going to direct the project, from the economic development to school lunch to health, human services, Medicare. Sometimes your purpose is not really achieved, because almost all the social program, the money is not benefit the targeted recipients. So the society is getting worse, and the election is really rigged. So I just hope you can really be careful when you want to use somebody. We want to have a project, you want to have appropriation, you must, in good faith, use the best people. Because all these agencies, law enforcement, they are all in to what I call, make it simple, is the bad guys. They send people to jail so you don't achieve your health purpose. And the health facility is so bad. They deprive people's sleeping and deprive people's health good, and then they take away people's health, insurance, everything. And then they take people's asset, everything. So how could you achieve your goal to have good health, to have a good family? So I hope you can really target it step by step, very carefully to select the good people. Don't allow the bad people to take your money away, to take government resources away.
Okay, thank you for your
Thank you.
comment.
Diego Rose, Tulane University. Barbara, another question for you. I appreciated the eloquent way you talked about the three functions of the committee, and there's a couple of things that are interesting to note about the dietary guidelines. Once upon a time, the Dietary Guidelines Advisory Committee report was the report of the dietary guidelines. They were the dietary guidelines. That's no longer the case, and the one function that you did not talk about is the federal oversight function, which is now split. So there's a Dietary Guidelines Advisory Committee report and the actual final dietary guidelines. That's a big gap in my mind, because we actually had a chapter on sustainability in the last dietary guidelines. It got excluded at the federal oversight part. So my question is, could we ever go back to the Dietary Guidelines Advisory Committee issuing the report, not going through the federal government? And what can we do about the filtering? Are we just, as our gentleman from CSPI, I think, just suggested, is it just going to be a political cycle so that we have to root for sustainability when the right people are in office, or is there?
Well, you know, I've been told there's advantages and disadvantages to becoming a senior in the nutrition field. So my first experience with the dietary guidelines goes back to the 1990 dietary guidelines when I was on the advisory committee. And I can assure you, in 1990, we wrote a report. Now, the report contained a lot of detail of what we thought the revisions to the brochure should be. But once again, that was a report that went to the secretaries, and then we saw what was released. But that's back in the days when the dietary guidelines was a 20-page, 30-page little pamphlet that came out. And during that period, the focus for the dietary guidelines was a consumer bulletin. We were told that any language we recommended should be written at an 8th grade level. It was a science report. We had to justify any changes to the dietary guidelines through a scientific justification, but it was really a consumer-oriented bulletin. I think the biggest change in the dietary guidelines came, I think it was the 2000 or 2005? The 2005 guidelines, where the decision was made that it didn't make sense to be producing a consumer bulletin through the advisory committee, that the advisory committee's strength was to do a scientific evaluation and to look at the evidence that supported the recommendations or any changes in recommendations. So that's when the department said, what we really want from the committee is a science advisory report, and then the bulletin itself would become a report aimed at policymakers. They're the ones who now would develop the consumer brochure. And there's a federal working group whose job as a federal working group is to make sure that any educational material that comes out of the departments is consistent with the dietary guidelines for Americans. So it's still a very powerful policy document. As you know, on the sustainability aspect, there was a lot of controversy around that, people going to their congressman, whatever. You know, could it have been handled a better way? You know, I think about one of the recommendations that our committee identified, where if you have an advisory committee that was constituted, chartered with certain charges, but in the process of their work, they find something that they think is important, but they weren't chartered to do that, how do they make sure it gets worked into the dietary guidelines process? You know, maybe their committee's job is to really make sure that the issue is brought forward in a way that it gets addressed in the future. And you probably can say that your committee did that. I mean, why are we having the discussion today? it's because of the controversy around how to include sustainability. So think of it as a success.
Ashkan Afshin from University of Washington. My question for panel is that if you could please comment on evidence on feasibility of achieving the goals that we have. Marco has done wonderful analysis on the different scenarios, and my question is that is there any evidence that we could achieve any of these scenarios? The result, the data shows that no country has been able to successfully reduce the prevalence of overweight and obesity over the last 30 years. Over the last 30 years, the consumption of nut and seed has increased only by 2 grams. Is it possible to increase that by 20 grams over the next 20 years? And I think that what are your thoughts about that? And has there any country been able to achieve at least any of these scenarios over the last few years?
Should I start with this?
Sure.
Well, on the country level, probably you won't find any example as you just suggested. I mean, if you look at specific dietary interventions, or also then you see some successes, right? For example, at Oxford, we're doing some studies of the success of weight loss programs, and they can be successful. They are very intensive in terms of resource requirements. But if you follow up a group of people with interventions, you can make them reduce overweight and obesity. I guess you have similar small case interventions with broader dietary changes. You have, of course, the example of the North Karelia study that you're probably familiar with, where in part of Finland, they really wanted to reduce the intake of saturated fats, I guess it was, and that was pretty successful. So there are some examples of dietary changes. What do we need for that? Well, probably everything we have, right? I mean, you see that, for example, sugary drinks taxes can be successful in reducing the consumption of sugary drinks. We did an analysis where we looked at what would greenhouse gas taxes do with food consumption. So if you tax food and according to its greenhouse gas emissions, can make a contribution, probably not enough to change diets so significantly. So you really need a multitude of different interventions. But I think the fact that we don't see like huge country level changes, or haven't seen huge country level changes, should tell us we should not try, right? I mean, the health won't get better magically. The environmental degradation won't get better magically. So I think we're called to action on all dimensions, and I hope we can sort of work towards that.
So in my business, there's no room for pessimism. One has to be optimistic, or you can't get up every day. But I do believe it's possible to shift, and to shift quite rapidly. I talked a little bit about, deploying some of the tried and tested private sector strategies to shift consumption that are used every day you enter into a shop. What purchase and what ends up in your basket or on your plate is largely influenced by some of these forces. I don't think that using just private sector strategies alone will go at the speed we need. I do think we need to start engaging some of the conditions, the policies, the price signal. But I actually think by moving businesses and showing businesses that you can be really successful in some of these shifts, like we are with some of the food services companies, they will become champions for us of lobbying government to actually put the needed changes in place. In this country, in the United States, during World War II, there was a rapid shift in people's dietary habits around meat. With the blockades and whatnot, we had, having to send food out to the forces. The people that were left behind, there was a strategy to shift them from, what they normally eat to organ meat. That was one of the most, successful and rapidly implemented strategies. In China, shark fin soup, there's been a number of campaigns around that. That sort of shifted from, the thing that you ate when you'd made it with all that money to now something that you really actually wouldn't touch. So I think there's ways to do this. And in fact, diets are really shifting rapidly as I speak in middle income and low countries. They're just not shifting in the direction we want. So we know they can shift. We just got to shift them in the right direction using some of the tried and tested strategies that work in the private sector every day you enter in the shop.
I would just add, in the U.S., we started labeling trans fatty acids in 2006, and it basically eliminated them from packaged foods and led to other kinds of campaigns in other communities to get trans fatty acids out of other parts of the food sector. And in fact, with the sugar-sweetened beverages, I think we've started to see the decline.
Strategy.
As soon as people became aware. So just to resonate with what Janet is saying, that there are changes that can happen quickly. Are we doing it in a way that's coordinated? If you decrease sugar-sweetened beverage, what increased? Is the whole system responding effectively?
And I would add to that there are things that are moving, but what we probably are not seeing at the country level is the socioeconomics that Adam highlighted, that if you probably do the socioeconomic, you would see differences.
One observation on the DG, I said that information, abstinence, and education campaigns don't work. So the big discussion around DGA is it's about an information at the end, but I'm not convinced that it's going to affect the general public, the dietary guidelines, because I'm not persuaded that really makes a big influence on what people order or buy. But I think it has a massive effect on the food manufacturing and food services sector. So I think of them as a primary target audience because they do compete around this issue.
Before the next question, let me just tell the audience we have 4 minutes left, so relatively direct questions, relatively brief answers. Thank you.
My question and answers discussion points are sort of stolen, so I'll be fast. So my name's Rebecca Mame. I work at the UConn Rudd Center for Food Policy and Obesity, and I actually was thinking about all this in the context of changes in sugary drink consumption and kind of using it as an analogy to think about behavior change in terms of reduced meat consumption in particular. So I was going to ask if y'all could compare and contrast, the interventions and approaches used to reduce sugary drink consumption versus, hypothetically some similar interventions or approaches to reduce meat consumption, and what are the pros and cons? So that was my question, which you started to get at already. So
it's a tough comparison, I would say. Sugary drinks is really something nobody needs ever, right? Whereas with meat, of course, people would argue in low-income settings, there is a benefit if people would eat some meat for improving nutritional status. So it's not that easy. I think in high-income countries and also middle-income countries, you can argue that we eat too much meat, right? But probably, and there are so many different types of meat as well, right? So I think it's a bit different. That doesn't mean that a campaign on, let's say, meat taxes or so wouldn't work, right? I think there are lots of different reasons why we should reduce meat consumption and highlight that in campaigns. But it's probably not an exact parallel to sugar drinks taxes. Sorry.
I just wanted to give another parallel example. So men's grooming products. My father, he would never be seen dead using any kind of men's grooming products other than his shaving equipment. But now in this country and in the UK, it's a multi-billion-dollar business. And so look at how they've done that. So how they've marketed their products. So they're all in black. They tend to be in black bottles. They have names like Face Feel or Urban Camouflage. They're placed right next to where the men would go to buy their bouts or whatever. They kind of figured out that men thinks it's not really masculine to have these products, so they've kind of addressed that in their marketing. Right? It's very effective.
I just want to make a comment because we're talking a lot about shifting behaviors, etc. And if we talk to any behaviors, they will tell you that positive reinforcement is the magic word. And we talk about taxes, etc. There are a lot of tools that we can use, but we should really keep in mind that positive reinforcement is one thing that we should not take out of the equation of changing behaviors.
Hi, my name is Ashley Lyles. I'm with MedPage Today. My question is for Dr. Schneeman. I was wondering, what role can medical doctors play in this, specifically in getting people to change their diet and their lifestyle?
My understanding is most people do still identify their medical their healthcare provider as where they get their information, or at least where they want to get their information. And yet, I think surveys then show that often it's the public media where the information is coming. I think medical doctors are a key resource to, first of all, emphasize the importance of nutrition, emphasize the importance of being healthy, and diet plays a role. I would encourage anyone in the medical profession to use tools like nutrition labeling, make sure that within their clinic they can help consumers understand how to use nutrition labeling. I think the dietetic profession there's a wonderful resource there of people who know how to work with individuals. Once you know what the medical conditions are, maybe the physician is not the best person to talk about the changes that can be made in their diet, but the dietitian who's on staff probably can be that resource. So I think there are a lot of ways, and I do perceive that many times consumers are looking to the medical profession for that assistance, so finding the way to do it is important.
Okay, the last question from this very patient young lady.
My name is Claudia Hitai. I work at USDA Economic Research Service. My question is whether any government has successfully included sustainability in their dietary guidelines.
So I think Brazil has, believe it or not. And they've got some of the most healthy guidelines that are out there. Now, I don't know what effect that has, but they apparently, but anyway.
Yeah, I think the question would be what's meant by successfully incorporate.
Yes, yeah, but the issue of environmental sustainability is front and center.
And I think the Netherlands also have.
There is a report by the FAO and FCRN. That surveys national dietary guidelines and sustainability aspects. So I would direct the person to this really.
I think there's a huge opportunity to get China to address this issue because of the way the government's set up there. But their healthcare system is it was designed for non-chronic problems, and is now it's creaking under the weight of the the type 2 diabetes, and that's provided by the government. So I think it's a huge incentive for them to address this issue, and they have the ability and means, in my view.
Janet, I think you get the last word on that. So between men's cosmetics and guidance to China, I think we're in good shape. Anyway, thank you very much, David, and thank you very much to the panel.